Do all your tinctures last that long?
Sorry?
All your tinctures, your remedies,
Do they last?
do they last? How long do they last?
Indefinitely.
Okay.
Yeah, they're in high alcohol. So they're well preserved. They're not in water. If it was in water, there is a shelf life. It loses its viability. Sometimes we administer the remedy in water, just by putting the drop in the water, but only for those purposes, for just dosing. But for storing, we keep it in high alcohol.
Did we have a discussion about how the remedy is prepared from the original substance?
No.
Because that's a really interesting part of homeopathy, an important concept to understand. So everything starts as a crude extract. If it's a mineral, which many remedies are, or if it's an animal substance, which many remedies are, or if it's a botanical. It all starts as a crude substance. What Hahnemann actually was doing when he first started learning the principles of homeopathy of like cures like, is he was actually experimenting with crude amounts of the substances. But what he found was using crude amounts would actually create a stronger aggravation in the patient. And so he started to play around with dilutions. And he found that as he diluted the crude substance by intervals of 10, so 10 times, for example, one part of the substance to 10 parts water, that the substance would still maintain its curative effect, but the aggravation would be much diminished. And so he actually went through this process of starting to create remedies of what are called all different potencies. And it was done by diluting one part of the substance in either 10 parts or 100 parts water or high alcohol extract. But the very key concept here is it's not just a straight dilution. There's actually a process called succussion where the dilution is vigorously shaken to transmit the essence or the energetic signature of the remedy. So those dilutions can go all the way times 10 to the 50th, which would be a 50M and beyond. So we're talking huge amounts of dilution, and the lowest potency obviously being a 1x, which would be 1 to 10. That could be the very lowest that could be considered homeopathic.
Right. So depicting this, if we take a crude substance, find the way.
No, go right ahead.
If we take a crude substance, it's a concentrated form. It's like the drug form of the substance, like a concentrate of deadly nightshade. And that is prepared so that it can be, we can take one drop of it. If we prepare these test tubes, we'll put in either 10 drops of water or 99 drops of water. Depends on whether you want to make a centesimal preparation or a decimal preparation. So if we take 99 drops of water, which is the potencies that we use, we're teaching this class in terms of centesimal, which is a more potent form. So we take 99 drops of water, and if we take one drop of the crude substance and put it in the 99 drops, we get 100. That stands for centesimal, 100. And then we succuss. Succussion is a very vigorous force against a solid object for at least 100 times. And what's happening is that this crude substance gets vibrated and perfused into the medium of the water so that the water starts to hold the frequency. And then after we succuss, we take one drop of that and put it into the next one. And logically, you can see that the longer you do this, it becomes much, much dilute. In other words, you're losing the molecular value of this concentrated substance. Once we reach Avogadro's number, which is the last point at which there's any measurable mole of any molecule in the water, there is nothing there. And the more that we do this, the more potent it becomes. So what's happening is that we're losing the toxic element of the substance. This is why homeopathic remedies do not produce a side effect. But we're maintaining the animating force of the plant or the substance. There is something that animates anything to be what it is, whether it's a mineral or a plant or an animal. And that is what is being preserved by succussing. If we did not succuss, this would just become a weak, ineffective substance. And Hahnemann discovered that because his first thought was, I'm not interested in the toxicity of this, like for example, mercury. I'm just going to make it weaker. He did that. It started to have no effect. And then he realized, like we talked about before, that everything in life actually is in motion. It's spinning. We're spinning. The earth is spinning. And so he simulated that motion as a way to transfer that energy into the next medium. Consequently, we end up with, this is a 12C. So this has been diluted 12 times, right, in the C potency. The potencies that we'll be addressing in this class are 30 C potencies. So it's 6 steps past Avogadro's number. So there's nothing in it.
So is 30C, is that stronger than the 12C?
30C is stronger than the 12C.
So the higher the number, the stronger
Yes.
it is. And then does it need to be shaken to activate it?
No, it's already done. That's what the mothers are. Once it's in the sugar, it's done.
So until Avogadro's number is, what potency would that be considered? Is that 6C though, when you reach Avogadro's number, or is that
It's a 24.
24?
Yeah.
And so then there's also, oh, sorry, go ahead.
The alcohol that is, that's put in it, what's that from?
Yeah, we use, it's actually very close to Everclear.
Okay.
Oh, wow.
It's very high.
Derived from
But
corn?
it
Yeah.
immediately vaporizes. I mean, it's gone, you know.
Is it derived from?
I don't know.
She was saying corn or potato or.
If you had a allergic reaction to corn and it was derived from corn,
No.
would you have a problem with it?
Remember, we have to talk about dose here, right?
Yeah,
So
I was thinking that.
that little vial, which you're taking 15 little pellets of, has 3 drops of alcohol distributed through the entire bottle. So, yeah. it's not very
We're not
little
taking
amount.
alcohol. We can give it to people who are severely alcoholic. There's no response from the alcohol.
Since we're talking about dosing, can homeopathic doses be taken with other medications, or should they be spaced out, and how should they be spaced out?
That's a good question. Ideally, you give the homeopathic remedy alone, meaning in a clean mouth. This is ideal. In a clean mouth without anything else with it. That means 10 minutes away from something to eat or any other substance in your mouth. However, if you were in a severe accident, you had a concussion, and you had been chewing gum, don't worry about it, do it. If it's the right remedy, it's going to have an effect. It's just ideally, the less interference there is, the better. And yes, we do use it as an interactive with other medicines. A lot of people, we may start on a homeopathic remedy while they're in the midst of taking a prescription drug. But we have to be very selective about that, and
Typically,
methodical.
it's repeated a little more frequently if there's heavy prescription drugs. Remember, we had that conversation about antidoting factors or disruptive factors, so repeat them more often, usually when there's a prescription drug that may be having an effect on the remedy.
And we may give it lower or often, so that there's a constant beat coming into the system about that influence. Hi.
Why?
Would there be, as a follow-up to that question, so then would there be a negative aspect to giving the higher potency at shorter intervals?
You could produce what's called a proving. The reason we have what's called a Materia Medica, I should have brought one, and a repertory, is that's a collection of all the provings that have been done in the past over 200 years, which is a way to understand what's unique about each remedy. When we give the little summaries of each remedy, that's from the provings. So the way the provings are done is that you take a healthy individual that doesn't necessarily need the remedy and you give it repeatedly. And when you do that, it starts to produce the symptoms that it will cure.
So you can think of it as not allowing the body to respond back if you're giving it too frequently, because it just keeps coming in and giving that stimulus again and again.
Okay, so even though you're not the healthy person taking the remedy, you're trying to get back to that balance of being healthy, you're still overloading with the higher potency too quickly, or?
You're giving what's called a primary response to the system.
Okay.
You're not letting it
Recover?
You're not letting it respond to the substance.
Okay.
Secondary.
Not getting the secondary response.
Okay.
Drugs are based on a primary response. Side effects are a secondary response.
I heard many years ago from a pharmacist I work with, and I've seen other reports of this, that they've had reports of children coming in with Belladonna poisoning.
Mm-hmm.
Have you heard this, and how could this even be possible? I mean...
Because it looks like a plant that's edible.
No, they're saying it was from the homeopathic.
Oh.
Have you heard this?
No.
I just don't even, okay. There's even an article that was talking about how effective homeopathy was, mentioned it again. And I don't know where they're,
well, I
was just curious if you've heard of it and if you have an idea of what
I
they
haven't.
have.
I mean,
Would it be the healthy child that took some and then it had the symptoms of what it's supposed to?
it would only be possible if it was approving, meaning it was administered inappropriately in a very low dose, and the child didn't need it.
Well, kids
Or
get into things, maybe.
understand also that a lot of products that are out there say it's homeopathic when it's actually an herb. So in one of the papers that you have in the article, it says homeopathy and herbology. I think that's the title, I can't remember. But it makes this distinction. And a lot of people are confused, that's why I wrote that article, about the difference between the Belladonna herb and the Belladonna homeopathic. And unfortunately, labeling in markets is erroneous. When it says homeopathic, what they're meaning is natural or something like that, but it's not homeopathic.
And remember how we talked about dilutions, that 1X, which is only 10-to-1, is technically homeopathic, can be legally labeled as such. So, for example, when herbs get pulled off the market, a lot of the companies just start selling it legally then in 1X potencies, because it's still a pretty material dose of the substance.
And it will be labeled homeopathic.
Right. But you can still call it homeopathic.
And the 1X is then retaining more of that toxic toxicity.
It's
versus-
virtually a tincture.
Okay, so the lower is more toxic
Yes.
than the
Yes.
30. Okay.
Yes. Yeah, very important clarification.
Yeah.
I have two questions. One on, you said that a lot of the stuff that you guys are going to teach us is going to be based off of the 30C. When could you take higher or know to take higher?
Okay, well, we use higher potencies for much more serious chronic conditions.
But what we'd be treating at home would be safe at the 30 level.
Yeah.
Beyond that, you should seek
Yeah, that's a
out.
good first choice.
Okay.
And if it's the correct remedy, the potency is not a huge issue in terms of what you prescribe. It's still going to act.
Okay.
So it's more in the constitutional prescribing we're usually using the higher potencies.
Okay.
And you had another question?
Yeah, and then creating our home kit, when you go shopping for, is there a certain brand to look for, or is it more of just who you buy it from?
That's a great segue to the announcement we want to make.
Yeah, so we briefly mentioned this at the beginning that we're going to be offering an ability for all the participants of the class to have their own remedy kit at the end of the class for the 35 remedies we covered. We've arranged through a homeopathic pharmacy to be able to offer the kit at an extremely reduced rate for what they would go for retail. It'll actually come in a little container with all the remedies separated with all the labels on them for the exact 35 remedies we're having custom made for this class. If you have some of the remedies already and you want individual remedies or just certain remedies, we'll be able to do that through our clinic. We haven't figured out the details, but...
Or you can buy them here at Pilgrims.
Right, or you can buy them here at Pilgrims.
What Pilgrims doesn't have is a kit.
Right.
If you want a kit that covers exactly what we've been going through, then we want you to sign up and tell us, because we have to order ahead of time in order to make that happen, because it's a special order. They're preparing it specially for Dr. Hunter and myself. Wanted to say that now so that you can think about that and let us know by the next week.
Do we have a price? Do we have a price on the kit yet? Or?
Yeah, I believe that the pricing is going to be $150 for 35 remedies, and usually the remedies would go retail for $10 to $11. So each, so it'd be full retail price would be about $350 or so. So it's a pretty significant savings.
Are these drams or half drams?
These are pretty big.
I think
Bigger
they're
ones,
full
like the
drams.
Highlands size?
No.
The Highlands
No.
size bottles?
It's not going to be that big as in the cell salts now.
It's pretty close to this size
That's
here.
that size, okay.
Yeah, each
Pretty close
remedy
to
will
one.
have about 50 doses in it, approximately. So, they're going to last a long time. Yeah.
And we can do refills at the clinic.
Right. So basically, we'll bring a sign-up sheet at the next class, and if you want the full remedy kit, then we'll just kind of need to know to give the homeopathic companies some preparatory time to make the remedies.
Go ahead, Daisha.
Is there a way I got a hold of a case? It's a homeopathic, old, probably over 30 years old, and there's open up in a lot of vials with the cork on top of it. Is there a way of finding out if the remedy inside of it is still useful?
No.
So can I just go and get the mother and just put a couple of drops and then call it?
There you go.
Good. Okay. I'll do that.
And can you provide us with a list of all the remedies that are going to be in the kit ahead of time? So
Sure.
people like me,
Yeah.
I have a lot of remedies at home. I don't need a whole kit, but I might like to supplement mine.
Yeah, when we do the sign-up sheet,
Okay.
because we'll by the end of the night tonight, we'll have covered 19 of them, but we'll
That's
just
a good question.
provide the whole
Good idea.
list. Absolutely.
One more
So
question.
if we had additional remedies that we wanted, then we would get them through, we can get them through your clinic?
Or through
Or
Pilgrims.
Pilgrims. Either way.
The same pharmacy, they use the same pharmacy as well for these remedies. It's not just what's on the shelf.
This is a different pharmacy here for Pilgrims than we use in the clinic, but it goes through the same process to prepare them.
Oh, okay.
So
Okay.
they will work equally effectively. Yes.
So it's not the B-O-I-R-O-N, Boreon, is it that?
No, we don't use boron.
Okay, so it wouldn't be just go into the market and pick something up, it would be go through the pharmacy too.
Either way,
Either way,
we want to get them.
Either way, they're going to be equivalent.
But if you want the entire kit at the really reduced rate, then we would need to know next week.
Well, I guess what I meant was once you get the kit, if you said, oh, well, there's a remedy that wasn't in the kit, can we get them through y'all as
Yes,
well?
sure.
Or- Okay.
Sure, but everything we will be covering in this class is in the kit, so it won't be there. Okay.
We just think of the kit as a starter kit, because you may run into certain conditions for which you do not have that remedy, and of course you can ask for it.
And bullet boxes make great
Yeah.
containers for your remedies.
Ammo.
Yeah, ammo.
Are the remedies, are they going to be in glass or plastic?
In glass.
Glass, so
Yeah.
there, okay. All right.
Well, we're gonna try and move a little more quickly through the conditions this week, so we have a little more time to spend on the remedies. We've got speeded up last class a little bit too much, and so we're going to try and move through the conditions a little more quickly.
Yeah. So when we move through the conditions, if you can just hold the questions about that particular condition till the end, and we'll try to answer them quickly. Like we said, it'll be a little quicker this week, a little more easy conditions to talk about, not as many red flags. The three conditions that will be covered are allergies, sinusitis, and earaches. So those should be the first 3 pages that are new to your packet of the condition overviews. So we'll start with allergies. The first paragraph about the etiology or the cause of allergies is pretty important here. A lot of people associate allergies with a pollen or with a dander from a pet or with a grass. They get them seasonally and they think, well, it must be the grass or it must be the pollen that's the underlying cause. In reality, there is an underlying state of inflammation and dysregulation of the immune system happening, which predisposes someone to developing these types of allergy responses. And typically, when we talk about inflammatory responses happening in the body, the main place we're really looking at first is the gut, because most of the immune system lives in the gut, and most of our exposure to the outside world actually happens through the food we eat. So if any of you are our patients, you all know this very well. We talk about food and its relationship to the immune system all the time, because most of allergy is set up by an imbalanced immune system, which is really oftentimes a result of disturbed gut dynamics and chronic exposures to foods that are revving up the immune system. So basically, when you get the acute allergy from the grass or the pollen or the animal dander, you can think of it as kind of an inflammatory response that is brimming over with that exposure to the allergen and producing the acute symptoms you're experiencing.
Samuel Hahnemann said a very important thing, which is first remove the obstacles to cure. So one of the reasons naturopathic medicine and homeopathic medicine are sort of cut out of the same cloth is naturopathic medicine is the way we remove the obstacles to cure. It just clears the way for a much more effective response homeopathically. So that's why we spend a lot of time on the gut dynamics, because we want to make sure that the gut is operating efficiently enough so that we don't get premature introduction of little proteins like from pollens prematurely entering into the bloodstream through a disrupted gut lumen and setting off an antibody production that produces the allergy. So that's why the food is very important.
Yeah. So, you know, allergies can take many forms. Many things can cause them, but in terms of the real symptom picture you're typically seeing with allergies, lots of sneezing, lots of runny noses, lots of watery discharges from the eyes. The nasal passageways can get obstructed and blocked up. You can get a postnasal drip, very common, even a cough, and actually this allergic inflammatory response can actually tire you out and you get fatigued oftentimes. So there are, you know, just a lot of generalized ways that an allergy can present itself, but we're going to be focusing more on the upper respiratory presentations of allergy for the class in terms of homeopathic treatment. In terms of red flags with allergies, there's not a lot of danger when you know you're dealing with an allergy. You obviously have to differentiate an allergic response to environmental substance from an acute infectious process. So you're looking for other signs of an infectious process like fever, like aches and chills, like discharges that are purulent or colored that have, you know, nasty smells to them. Those types of symptoms, they would suggest it's infectious versus something that's allergic, which is usually really watery, just irritative, it's self-limiting, and it's related to exposure to something.
The exception would be is a severe allergic response that happens immediately, causing anaphylaxis. So a bee venom or eating peanuts, something like that. This is where you would want to have a remedy handy very quickly, because you don't have much time if there's anaphylaxis, unless you got an EpiPen. So there is a remedy in your kit for that, because some of these remedies will work as an antihistamine.
So yeah, I mean, obviously, we talked about this before, when the airway gets compromised and the anaphylactic type response, you're taking the remedy on the way to an urgent care or something, because if that airway closes up, you're in a lot of trouble. So naturopathic management, they do first of all, allergies can do very well with homeopathic treatment, but we have to realize, those underlying obstacles have to be addressed, like Dr. Todd said, in order to really cure allergies. It's not like a homeopathic remedy is going to deal with that underlying dysregulated immune system. But a few things that you can do to really help sensitize you to allergies and reduce symptomatology. One great thing is finding some raw local honey and consuming that, especially before seasonal allergies really ramp up, if it's a seasonal thing, to get your immune system prepared. You can also take a square of honeycomb and eat one of those every day in preparation for allergy season. The idea is you're sensitizing your immune system to the allergen.
Does pollen do the same thing, bee pollen, as honeycomb? Would that be so?
Right, I mean, honeycomb has bee pollen in it, correct.
Yes, as you could know.
Right.
And this is addressing if it's a pollen that
Right.
is developing the sensitivity.
Right. But the bees are, going into all the flowers, so the idea is that the honey and the honeycomb have all the regional local pollens. A couple of really good stabilizing nutrients that help stabilize the immunological reaction that creates the symptoms of allergy are quercetin and vitamin C. They're over the counter. You can pick them up here at Pilgrim's. I've mentioned some dosages that you can use. It would be like a natural Claritin, you could say. So it's kind of calming down that immune response. Stinging nettle root, same thing, it's an herb, but it's going to modulate the immune system, quiet it down. Nasal lavage or Neti Pots is just a way to actually irrigate the tissues, remove congestion. Everyone heard of a Neti Pot, know what that is? It's a saline solution with a salt component, so it's hypertonic, so it can pull out the mucousy congestive substances and open up the airways. And then another big thing is removing obstacles, right? So if you have a pet that's sleeping in your room that is one of the causes of your allergies, it's important to get the pet out of your room. Really be careful about your home hygiene, vacuuming, dusting. You can use HEPA filters. These things can make a really big difference for people with persistent chronic allergies. You really have to do a home hygiene kind of thing and look around.
Yeah, if you're allergic to feathers, remove the tick, right, on your bed, or the pillow, right?
So those are the main principles in terms of naturopathic supportive measurement. I've listed the remedies we'll cover in a few minutes here related to allergy, which will also come up later in the class for the most part too in other conditions.
There's a couple more. One you already know, which is one of the biggest antihistamines is water, so staying really well hydrated. And another one is B5. B5 is an antihistamine, but you have to take it in pretty large amounts, 1,000 to 2,000 milligrams per dose. It works quite well, and it's very safe. There's no side effect to it.
B what?
5, pantothenic acid.
1,000 to how many?
1 to 2 grams.
1 to 2 grams. Grams.
Every few hours.
Or 1 to 2,000.
Yeah, as needed,
Which should give you an idea on your supplement, that's going to be, probably 100 times more than is on a multivitamin.
Oh yeah.
Way, way, way more. So, any questions about the allergy section before we move on? Yeah.
Would it be possible to, if you got like a pet that's been stung a bunch of times, which has happened to one of my bird dogs quite a few times, and you have to rush him into the vet because he just blows up big, would that work on him?
Homeopathics?
Yeah.
Yes. Absolutely.
Do you know how to administer the remedy on a dog?
Not yet.
When they're relaxed or sleeping, pull their side lip down and put it into the buccal cavity. If you try to open their mouth, they won't usually let you, but you can pull the lip down. Same with the child. If the child's asleep, just pull their lip down when they're sleeping and just put it right there, and you're done.
And that's
You
actually,
don't have to wake them up.
that's one thing we forgot to mention. The last part of preparing remedies is taking the remedy. We talked about staying away from food, but where do you actually put the granules when you put them in your mouth? So you tap out 10 to 15 little granules in terms of the remedies we have, and you'd want to put those granules sublingually, which is under your tongue. There's a more direct form of absorption that way, and so that's how we recommend people administer the remedies.
Will it still work on a child if they just have it in their mouth?
It will.
Yeah.
Okay.
Yeah.
Because my son would wake up if I tried that at night.
Right. Yeah. And kids,
So
you
you
see
can put it
get
into the buccal cavity here.
Right. Right. So you don't swallow them, put them under the tongue. That's the most efficient way of absorption.
And usually kids are like totally into it.
No, mine is.
You have to hide the remedy because
It's sugar.
it
They
tastes
love
too
it.
good. Right?
They love it.
Are these directed more toward environmental versus food allergies, or food allergies? Would it be the same if the response is the same?
Same.
Yeah.
Okay, so this would address.
Right.
Yeah.
It's going to be more related to that brimming over effect we talked about in relation to environmental exposures. That's where most of these symptoms are going to show up.
Okay.
But the underlying issue often is the food piece.
So if you're healing your gut, and then you happen to have exposure to the food that you have a known allergy to, do you, as you're healing your immunity, should that response be diminished? That histamine response, should that actually diminish? Is that?
In general, yes,
Okay.
but in the early stages of healing, you sometimes may have an aggravation.
Okay.
Only because your immune system is much more primed now, so it may have a stronger response. But after that, amelioration usually happens predictably.
Okay.
Dr. Todd, I was going to hold my question. Since you mentioned healing your gut, would you recommend doing an acidophilus before allergy season starts to get your gut in better shape?
The main thing is the food choices you make.
Okay.
Yeah. Even the probiotics have a hard time helping you if their gut dynamics are messed up. Right.
That B5, the 1,000 to 2,000 milligrams, how often would that be taken?
As needed. I would say, depends on how strong this allergic response is going on, but 1,000 to 2,000 milligrams every 4 hours is a very rough idea.
That would be for adult or kid, wouldn't matter?
Pardon?
Wouldn't matter if it was an adult or a kid? A child?
If it's a child, I would take the lower dose, 1,000.
Okay.
Let's go on to.
Right. So earaches, or the medical term is otitis media. So this just needs a little orientation in terms of anatomy. When we talk about earaches, we're generally talking about the middle ear. There's three parts to the ear. There's the outer ear, which is inflammation of the outer ear, would be otitis externa.
Canal.
The ear canal. There's much rarer to have that. It's very, very painful, and it's on the outer tissues of the ear. And then there's the middle ear, which is most of what we'll be talking about today, which is otitis media, inflammation of the middle ear. That is the fluid. Well, it's a layer between the tympanic membrane, which is what transmits sound from the external world, to the inner ear, which is how we then take the information that gets transmitted through the middle ear into the inner ear and gets turned into information for the brain to process the sound. So that middle ear is a tube that's usually hollow. And what happens in otitis media is there's typically a preceding infection, like a viral upper respiratory infection, a sore throat, a cough, a sinus infection, that then gets evolved or transmitted into an earache or otitis media. So what happens is that inflammatory process creates edema or swelling, which kind of blocks up the eustachian tube, and there's a bunch of secretions that accumulate in that tube, and they have no way to get out. So consequently, you have a blockage of fluid in that tube, and that blockage and swelling process creates a lot of pain and can create a lot of discomfort, especially for children.
And it's so typical for very young kids, like infants, to get an ear infection because their head hasn't elongated yet, so this canal is not tilted, it's more horizontal, so it doesn't drain as quickly. You understand that the eustachian tube goes from the middle ear to the throat, and that's how it depressurizes itself. But if it's blocked, then the fluids back up just like into a pond, and it sets up a really beautiful environment for bacterial overgrowth, and that's how you get an ear infection. So you're going to get some symptoms, and we're going to hopefully select the right remedy for that, because an antibiotic is only treating the overgrowth of the bacteria. It's not really treating the cause of the ear infection. And consequently, even standard medical care now is sort of trying to not do antibiotics because it sets up chronic otitis media.
So symptoms in very young children, they might not be able to either verbally talk about ear hurting, or they might not be actually complaining about their ear. They just might be really irritable, have a fever, be cranky, not want to eat very much. So, look out for that in young children. They might not be complaining exactly of their ear, even if they have otitis. But ear pain is the most common symptom, obviously. There are other related symptoms related to an upper respiratory infection. If you were actually to be able to look in the ear with what's called an otoscope, I'm sure you've all had that used on you before. It's a magnifying glass that can look at that eardrum. You might see it bulging or retracted, which relates to, again, that fluid inflammatory accumulation. If you were to look in there, there might also be some discharge if there's actual rupture of that membrane. It happens not very often, but that pressure can build up so much that membrane can actually rupture, and you can have discharge coming out of the ear, and that's can be seen just actually dripping out of the ear, like depending on what the consistency is. There's all different ways that can happen. We'll talk about that in relation to the remedies. So red flags, again, pretty self-limiting illnesses. They can be very annoying and very uncomfortable, but very little chance that an earache is going to turn into something life-threatening, serious that absolutely needs to seek medical care. But the two big things that may happen is what's called meningitis. We talked about that last week, which is an infection spreading into the meningeal layer of the brain, very serious. It's an urgent referral situation. We talked about people having lack of response, being obtunded was the term I used, meaning they don't have verbal or mental acuity there. There can be a very, very high fever is a big sign that may be happening. The other condition is called mastoiditis, which is a spread of that ear infection into the mastoid process, which if you press behind your ear, just to the lower portion, you'll feel a bump there. That's your mastoid. And very rarely that can actually become infected. It would become red and swollen, and you typically get a really high fever. That's a sign of infection spreading out of that isolated canal into the other tissues and towards the bloodstream, which is dangerous.
It's pretty serious because it's a closed sinus. So once it gets in there, traditionally it's a surgical procedure, but it's treatable with homeopathy.
Right. So management naturopathically, we talked about the diet recommendations last week for upper respiratory infections. Those would all be the same recommendations: broths, lots of water, no dairy, sugary things. Other adjunctive therapies you can use for kind of soothing the pain and calming things down is using garlic and olive oil infusions. So taking olive oil, infusing it with garlic, which is an antimicrobial, and warming up that garlic and dropping 2 or 3 drops in the affected ear and then plugging it with a cotton ball. The big caveat there is you don't want to do that with discharge with a ruptured membrane. So you want to make sure that tympanic membrane is sealed. There's no discharge if you're going to use that. You can stick it in the ear, go to sleep, leave it in. It will kind of help soothe things there. The next recommendation, the warming socks, we talked about that last week. Same principle here. It's going to be pulling the congestion and deriving it down to the feet by that process of the body warming up those wet socks. Really excellent therapy. Similarly, the hydrotherapy can be done locally. You can actually apply a hot and cold poultice of a cold and hot washcloth or other material directly to the ear. Idea is to increase circulation to that tissue, build up the immunity, and relieve congestion. Lymphatic massage is another thing that can be done, actually gently moving around the ears, massaging the lymph fluid down towards the heart. Can be also done as just an adjunctive thing. Other questions on otitis before we move on to sinusitis? So sinusitis is kind of along the same lines as otitis. We're doing typically an upper respiratory infection that turns into a congestion of other tissues. So it usually starts with a sore throat, a little cough, a little fever, bacterial or viral infection, most commonly viral. And essentially that infectious process travels into the paranasal sinuses, which are behind the nose. So the main sinus cavities are maxillary, which is below your eyes, right in the middle of your face. There's a frontal sinus, and then there's some deeper sinuses in there too, like at the root of the nose. And a couple above your eyes called the ethmoid sinuses. So basically what happens is that viral infection migrates into those cavities, and the inflammation follows, and the subsequent edema or swelling, and then bringing in of fluids into those cavities happens. And you get a headache and a very strong pressure of those fluids pushing against the nerve endings. So that's generally what happens in the development of sinusitis. So the main symptoms are going to be nasal congestion and obstruction. You might actually have discharge coming out of the nose. It can be colored, foul smelling. There's going to be all the other symptoms of a typical upper respiratory infection, like a fever and fatigue and kind of the types of things you would expect when you have an acute illness like this. Red flags, like we talked about in otitis, we're concerned with the infection spreading into more serious tissues like the meninges. Same ideas with symptoms of meningitis. Another thing that can happen with sinusitis is very close to the sinus cavities are the orbits of the eyes. So you can get something called periorbital cellulitis, which is a pretty serious condition. You'd start to get very prominent, fast swelling of the eye tissues with a really high fever. It's a sign that you need to seek out more care if that's the case. Very rare. Those are the main things that we'd be concerned about with sinusitis. Naturopathic therapies, very similar to otitis in a lot of ways. We're going to do the warming socks. We're going to do the same diet. A couple of other things that can be really helpful, the nasal irrigation. We talked about the Neti Pots. Can be very good to start pulling out some of that mucus, thinning it out, relieving some of that congestion. Steam inhalation does a similar thing in terms of principles. It will bring in water to loosen up some of those really thick secretions and allow them to drain out more easily of the sinus cavities. The warming socks we talked about, same ideas with the earaches. And then one nutrient that can be very helpful is N-acetylcysteine, which is an amino acid that has a very mucolytic profile to its action in the body. So when taken in high doses, which I've written out the dosage here, it can really help thin mucus when it's taken at 1,200 milligrams twice a day. The last thing that can't be overlooked here is water. Really, really important, because what's happening in sinusitis is you have this congestion of mucus that is too thick to really empty out of the cavities. So more water will help thin out that mucus and make it more dischargeable out of the sinuses. Questions?
just like to make a statement about the hydrotherapy. It just works so well. My husband would get sinus infections that he'd miss work, and he would know immediately if it was going to be in his sinuses or not. It just was that kind of ache. And he did a hot washcloth as hot as he could stand it on his face, followed by the cold. So we didn't have to get in the shower and do all that, but he would do it 4 or 5 times a day. And the relief of the pressure and the pain was almost immediate. So just awesome therapy, the hydrotherapy. You don't have to get in the shower.
hydro.
If you just have a bad cold with congestion up here, is that N-acetylcysteine something you can take just for something lesser?
Yeah. Wherever you see excess mucus production, NAC is great. In fact, if it's a very early stage of a cold, NAC is you can prevent it from progressing pretty quickly if you can clean off the mucous membranes, because what allows it to evolve into something more serious is overgrowth on the mucus. So if you remove the substrate, you're going to be clear quicker.
And in terms of producing that substrate is through diet, right? So that's why the recommendations with the fasting.
Yeah, the only way you can get sinusitis is by doing something that the body is trying to get rid of. So in a healthy person, the mucous membranes are where I would prefer to have this take place, because it's a slippery place to move out what it is that's toxic. So if it builds up far enough, then you're going to be set up for a sinusitis or something like that. And that's why we don't want to suppress it. We want to do something that makes it successful at being complete.
So would you take the NAC like prior to taking a remedy, or would you take them together?
At least 10 minutes apart.
Okay, but it would be something that maybe when one's coming on, then you'd start with that and some of the other
Yeah, you may not need to give a
suggestions.
remedy at all.
And then, but if it
Right.
continues to progress, then you would move on to a remedy with that still,
Correct.
though.
You got it.
And remember the discussion from last week that oftentimes all of these conditions are just like sore throat and the cough. We might not need a remedy at all. And we certainly don't want to give a remedy until the symptoms clearly differentiate themselves. If you're not able to get a clear symptom picture, homeopathy is going to be really disappointing for you because you're just going to be grasping at straws. So remember that. That's an important piece.
So the first remedy is Allium cepa. Allium cepa is onion. You can get a real quick visual picture of what that's kind of like by cutting onions, right? You get a lot of lacrimation in the eyes. So Allium cepa, very good for where the target seems to be the eyes. Frontal sinuses get involved. If there's a cough associated with it, it's because you're getting a postnasal drip from the mucous membranes dropping back into the back of the throat. The discharge from the eyes is bland, but it's acrid and excoriates the nose. This is a very important distinction from the next remedy, which is euphrasia, which is the opposite. We'll get to that. But there's a lot of lacrimation in the eyes. It doesn't sting the eyes, but the nose discharge does bother you. It's irritating the tissue around the nose.
And this is like a, gushing, thin, watery discharge. So it's not going to be thick, it's not going to be colored. It's,
right.
The classic allergy, runny nose, runny eyes.
Just think about when you're cutting onions. This is approving of onion.
The one
you can get a headache from it.
The one distinction would just be that there's not as much burning, like when you do onions or you're chopping onions. That's the next remedy we're going to talk about in the eyes.
You can get a lot of sneezing going on with it. It's worse with warm atmosphere or humidity in the room. Is better with going out in the fresh air. Better with cold air. Usually worse in the afternoon or evenings. And definitely worse with pollens and exposure to antigens from the environment. So, Allium cepa is in your kit, and it will be something you will probably call upon in the early stages of the onset of a cold or an allergy.
Right, and that's really the only context we're going to talk about that remedy. So that's kind of where you're going to, the sphere that you're going to see it most commonly as an acute allergy or cold remedy.
Quick onset,
right.
A lot of targeting around the eyes,
Right.
Watery discharge, better going outside.
So the next remedy, euphrasia, is called eyebright. It's a botanical, it's a plant. Eyebright is actually used as a botanical preparation for allergies and for concerns of the eye too. It's also very useful in inflammatory conditions of the eye as an antioxidant. So useful in the botanical world as well as homeopathically. The homeopathic sphere happens to really center around allergies, the eyes, the nose. You're going to see it with hay fever, with acute allergies, conjunctivitis, which is inflammation of the eyelids and the eyes. You're going to see it in colds a little bit. Like Dr. Todd already mentioned, the big take home from this remedy is that you're going to have very similar amount of lots of watery discharge running from the nose and the eyes, but the excoriation is going to be happening in the eyes. It's going to be really, really irritated. There's going to be burning, there's going to be itching, there's going to be even changes in vision. So there's going to be a lot of uncomfortableness and pain around the eyes and burning versus the nose, which is going to be really bland. There's not going to be that excoriation on the lips or the nose, nostrils. It's going to be very bland nasal discharge.
So that's the flip of Allium cepa.
Right. So the concomitant, you read postnasal drainage collects at night. So basically lots of postnasal, the cough you're going to get is from the postnasal drip, which is classic allergy thing. And then reason it's worse in the morning partially is because all that drainage is going to wake you up in the morning and there's going to be a lot to kind of get out of your chest and it's going to aggravate in the morning. Similar to allium, it's worse in the warm breezes and in the wind, kind of like pollens are worse in that type of weather, and it tends to be better and dry out a little bit as it comes towards night. And so these are pretty quick remedies, and that's just the main differentiating point that we've really tried to hammer home. That's what you really have to be looking for. And this is when it's acute allergy with lots and lots of runny nose and eyes.
Any questions about euphrasia?
So could it be used if somebody just has conjunctivitis?
Oh, of course.
Oh, yeah.
That's what we would use. Okay.
But again, you want those modalities to match up.
Right.
You know, it's really an irritant to the eye, not so much the nose, right? Watery. Now, if there's pus involved, and you get a lot of crustiness and purulent activity, there might be some other considerations going on. Like another remedy will come to you pretty quick. Arsenicum. Arsenicum is a huge remedy. It is a remedy that can be used for many purposes. And having said that, keep in mind that this little cluster of remedies that we're associating with these three conditions that we're talking about, don't limit it. Don't limit these considerations to just this cluster. The remedies that we talked about last week could be just as relevant, right? It's looking at the modalities and looking at the keynotes. We're just going over the remedies that are really good considerations for each of these conditions. Arsenicum, think of arsenicum as a nervous, restless, burning remedy. Arsenicum is got a lot, like aconite we talked about last week, has a lot of fear and anxiety to it. It's a lot of nervousness, a lot of pacing, a lot of over concern about details, and the discharges are burning. They're excoriating, whether it's diarrhea or whether it's burning from the eyes, burning from the nose. It's burning. They will say, this stings and burns. It hurts, and you can see the excoriation redness. It's a watery discharge too. It is not purulent. It's not colored. It's a fairly intense remedy, like the one we talked about, aconite, last week. There's a lot of intensity to it. There may be other symptoms associated with it, like diarrhea going on at the same time that you're having sinusitis or some other symptomatology. It's worse in the cold. It wants warmth. It's usually worse after midnight. Very typically, you can be awoken with a cough or difficulty breathing between 12 midnight and 2 a.m. and nervous wakefulness, maybe some fear. Sometimes Arsenicum can be so anxious that they don't even want to go to bed because they're afraid they're going to die during the night. They want warm foods, they want warm drinks, they want company, but it's hard to console them, even though they want company. They're still anxious. Thirsty, but when they drink, it's in little amounts. They don't have time to drink much more than a little amount. They're pacing. They're overly concerned about details. Want things in order. Did you do this? Did you do that yet? It has nothing to do with the condition. It's fastidious, meticulous. This is a perfectionist.
A real annoying patient.
And so if you see that generalized picture of that remedy, I mean, that's really what you're looking for. The actual symptomatology itself you want to touch up, but if you see all those concomitant symptoms in that left lower box and it fits the picture of Arsenicum, there's a very good chance that that remedy will have an action.
Did you ever see that movie, I think it was called The Rose? It was a movie about the Inquisition and monks in a monastery, and one of the monks was secretly working as a scribe and wetting his finger to read some of the scripts, but it was written with arsenic in it, and he eventually died. But the presentation of his onset of illness was this maniac person who became very, very agitated and restless and couldn't settle down. Arsenic has been used for killing a relative that you don't like.
Arsenic,
very poisonous, yes.
Okay. So our next remedy, Natrum Muriaticum, this is another huge remedy. It's what we call polychris, remedy of many uses. Very prominently used constitutionally, but also for many, many different acute complaints. Natrum Muriaticum is common salt. It's table salt. That's what it is prepared from. A lot of conditions that we're going to look at it from an acute perspective. The allergies and the hay fever is one major one. It comes up big with headaches. Skin issues is very common, especially herpetic types of eruptions, cold sores, herpes zoster, shingles, stuff like that. coughs with lots of lacrimation or streaming discharge from the eyes, and ailments from prolonged grief. And that's a good segue into talking about the character of a Natrum Muriaticum, because like Arsenicum, there's a very strong picture of this type of individual that is needing this remedy and can really guide you to the correct prescription when it fits. So a Natrum Muriaticum individual is typically going to be a very serious, very responsible person. They're sensitive, so they pick up on a lot of things, and consequently, they can really easily be offended. They're so sensitive that things that people say have a really strong impact on them. But the thing about Natrum Muriaticum is they're going to hold on to it. So most of us would just, maybe something wouldn't sit with us quite right, and would bother us for a minute, we'd get over it. Well, Natrum Muriaticum could literally dwell on that for days or weeks or months of that little thing and hold a grudge against that person forever after that from some little offense. So they really hold on to things that have happened in their past, and they're often dwelling on these past disagreeable occurrences. That can happen in the form of grief too. So it's a major remedy that comes up with prolonged griefs, something where there's been something that's upset them in the past or that has made them sad that they just cannot get over. Now, they're not going to tell you about that. They're very closed people. So Natrum Muriaticum would try everything they could not to cry in front of you, for example, because they don't want people to, don't want to let their walls down, let people inside. So they're not going to want to be consoled. They're very averse to consolation. When they're sick or upset, they're going to want to go off and be by themselves. That's very classic of Natrum Muriaticum. A couple of other things. This sensitiveness can kind of come out in that there are people who can't go to the bathroom in a public place because they're so closed and private. That's a classic sign of it. A couple of other things that you can see with them. They crave salt, which obviously Natrum Muriaticum is made of salt. Very, very commonly there's going to be a strong craving for salt. So that kind of gives you a picture of the Natrum Muriaticum person, and I'm sure Dr. Todd can enhance that picture.
The reason we're putting it in the kit is because even though it has this overlay of what could be very constitutional big issues in a person's life, it's hard to be a human being and not come across Natrum Muriaticum at some point in their life. We've all had experiences of being hurt and rejected. But we're putting in the kit because it has relevance to acute issues, especially with respect to sinusitis, allergic reactions, because it'll produce, like in the start of a allergy or a sinusitis, it'll start with sneezing. So maybe the first symptom that you'll get is a lot of sneezing, and then you'll notice maybe a little sore throat starting or a little congestion starting. That's usually Natrum Muriaticum. If you're prone to any herpes simplex or cold sores, you might see something starting on your lips. And you usually will have a headache with it. There's an early onset. Natrum Muriaticum is very prone to headaches associated with the onset of the other conditions. And the other thing about Natrum Muriaticum that could be useful is that a lot of the discharges go down the back of the throat, and it will produce a cough. And when the cough happens, you cough, 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 and it'll make your eyes water. When you're peeing, you may lacrimate the eyes. It's kind of strange that way. Again, Natrum Muriaticum is so much a part of being a human being because a lot of us is salt. A good picture of Natrum Muriaticum is the Bible story of the woman who turned around to look at the destruction that was happening in her city and turned to a column of salt. And that's the metaphor of dwelling on the past. So Natrum Muriaticum tends to kind of go to bed and then try to re-script that terrible conversation or event that took place and want to redo it. If I had only said this, if I wish I had said that, and they're looking back. It's very difficult for Natrum Muriaticum to look forward. And that stuckness on the past is what creates a big component of the need for Natrum Muriaticum. Having said that, the reason it's in the kit is because of these early onset symptoms that can have a lot of discharges and sneezing and the onset of cold.
And just to highlight a couple of the major modalities that really show up strongly with this remedy, sunlight can really aggravate a Natrum Muriaticum. And that's particularly in relation, you could say, to some of the acute symptoms. So if someone has an allergy or a sinusitis, gets much worse in the sunlight, think of Natrum Muriaticum. That's a big, big symptom with it.
That's a good point.
And there can be an aggravation at 10 in the morning to 3 p.m., which a lot of these remedies we're talking about are nighttime aggravation. Natrum Muriaticum can really be a lot worse in the mid-morning to kind of early afternoon is when a lot of their symptoms can really spike up. So you can see that a lot. And then the discharges in a lot of the Materia Medicas, to be really specific, they kind of talk about it. We talked about Allium cepa and Euphrasia as being really, really watery. Well, this one is more of like, can be kind of an egg white consistency. It can be a little, it's still clear, it's not purulent or colored, but it's going to be a whitish. Yeah, more whitish, a little more sticky, not just profuse, kind of flowing like a water faucet. And I think that kind of does a nice summary of the remedy.
That's good. Nux vomica. Think of Nux vomica. This is made from the strychnine of the poison nut, muscle poison. Nux, think of hangover when you think of Nux vomica. Nux vomica, the symptoms that come about are the result of excess, indulgences, overdoing something, whether it be foods of a certain kind, alcohol of a certain kind, too much sex, it's excess. And the resulting effect is a lot of these symptoms. So you can get nausea, you can get constipation, you can get a lot of indigestion. It's a big gastrointestinal remedy. Difficult to rest, to sleep well. You usually wake up in the morning not feeling well. The interesting thing about the discharges in Nux vomica is that it's pretty watery, fluent discharge during the day, morning during the day, and as you get closer to night and actually during sleep, it can become very congested and it's not flowing and it's very stuffy and it's hard to breathe through your nose. So the discharges that become worse during the night, causing you to have to breathe through your mouth, think about Nux vomica. One of the features that is so classical of Nux vomica is constipation, but you can also have the same thing happen with urinary tract infections, where there's an urging, but there's not much response. So you have to strain, and it's not effectual. Hey, Carl.
You can think of this person really wound up, really intense and irritable, and they're so wound up that there's spasm happening, right? Spasm all over the body, spasm of the colon, spasm of the urinary tract. That's a big theme with Nux vomica.
They can be irritable, not much patience, nervous, fault finding. They can easily fight with you, argue.
This is the classic, if you were to make an archetype of a type A personality, you know, Nux would be one of the leading remedies to talk about.
Along with Arsenicum.
Right. And like Arsenicum, they're also very, very chilly. Nux is always really cold. They want to be under blankets. They feel better under blankets. Much worse in cold air and in open air. Uncovering will aggravate. Dry, cold weather, not good for them. So they want warm drinks, warm applications. If you wake them up from a nap, they'll be really cranky.
Good. Any questions about that?
So Pulsatilla, which is, again, another huge remedy. We're going to probably be kind of brief on this because of time. We're going to come back to Pulsatilla a lot. It's going to be in a lot of these acutes. It's also a big constitutional remedy. But one of the major affinities it has is for the nose, the ears, the sinus. And typically, in the acute sense, one of the big things about Pulsatilla, in terms of the descriptors, the upper right corner, is that they're going to have very thick, juicy, bland discharges. Kind of, they can be yellowish green, but lots and lots of thick discharges. So it's partly why it's such a great sinusitis remedy, with lots of snotty, thick, yellowish discharge. Think about Pulsatilla. The other thing about Pulsatilla that's really important, that really gives it a lot of its character, is in the modalities, which is very unique to Pulsatilla in that they really, really want to be in open, fresh air. They're going to tell you, I sleep with the window cracked open. My sinusitis feels so much better when I go outside in the open air. Another big thing is they really feel much better when they're moving. So when they move slowly, not really fast pacing like a different remedy we'll talk about, but for example, kids who are sick with an upper respiratory infection, they're going to want to be held by their mother and gently moved around. That's a big keynote for Pulsatilla. That's very important for them. On the flip side, where they like cold air so much, they're going to be really aggravated by stuffy, warm rooms. So they're going to say, all my symptoms are worse when I go into a hot room. When I put hot on the site that's being affected, it's going to aggravate it, versus when I put cold on, it's going to feel better. So those are really big modalities to point you towards Pulsatilla. A few other things: that rich fatty foods will aggravate all their conditions. That's a big Pulsatilla symptom. Generally worse in the evening time. A big thing with Pulsatilla too for a modality is they really want to be consoled. And this kind of goes to the picture of a Pulsatilla, is that they really, really want consolation. They want sympathy and affection. That's partly why they like to be rocked so much when they're kids. They're very needy for attention. They want your attention. They want your sympathy. They're very open, so they'll weep a lot. They can be very weepy with their illnesses, but not in a malicious way. Not in a way like, oh my gosh, this is so painful, I can't bear the pain, like we talked about Hepar, but more in just, they're very, very weepy because they want that consolation. They want to feel recognized and noticed. One other big thing to think about with Pulsatilla is their symptoms can change a lot. It's maybe the most changeable remedy in the Materia Medica. So they might complain of an earache on the right side, and then it may move to the left, and then it may move back to the right. Same thing with a sinusitis, it can go to different places. They can, say 1 minute it's fine, and the next minute it's way worse. And so as they're reporting the symptoms, they can keep bouncing around and changing. That's very typical of Pulsatilla. It's a big keynote for this remedy. They're typically mild people. They're very affectionate. You get this idea of being clingy, wanting affection, being very sweet. Lots of times when they have these upper respiratory things, they're going to start as an upper respiratory tract infection, like a sore throat, and they're going to progress into these things like acute earaches or acute sinusitis.
And usually Pulsatilla is not a remedy that you'll see at the beginning of a sinusitis or congestion. You'll see it once it begins to produce a very thick, bland, colored discharge.
And so it's usually the latter stages of something that is built up. Pulsatilla, characteristically, you feel very sympathetic for. You want to help them. You feel their suffering. And it's something you want to assist with, unlike another remedy we'll talk about very shortly. It causes you to feel heartfully drawn to compassionately helping. This is true for the kids, it's true for the adults. And they're kind of the opposite of Natrum Muriaticum, where Natrum Muriaticum is very cautious and reluctant, whereas Pulsatilla is right out there, very transparent and very open, too much almost, so that it becomes very evident that it's not Natrum Muriaticum.
In a quick contrast to another later stage discharge type remedy that we've already talked about that we're not going to go over much today is Hepar-Sulf. So that's also a later stage with lots of productive discharge. But the big difference with Hepar, right, is the modalities. You have to think about the modalities. They're very, very chilly. They really want warm and heat. They want to be in a hot, warm room. They're really aggravated by the outside. So you know immediately, even if there's lots of discharge, exactly how to distinguish between these two remedies. And Hepar is going to be really cranky, really irritable, and Pulsatilla is going to be mild and sweet. So very easy to see the remedies apart, but they both can have a similar discharge. So if you don't differentiate modalities, you can miss it.
Hepar wants lots of warm drinks, whereas Pulsatilla, they don't want anything to drink. They're very thirstless.
Right. That's another big one.
Is that in today's?
It's
or is
last
that
week.
Okay.
Yeah, we covered it, but it's in here listed as a big sinusitis remedy, used very frequently. But that's a differentiating.
So another one that can look like Pulsatilla is Calibi, Calibi chromicum. Calibi chromicum, think of, again, it's a latter stage development of congestion where the mucus is very thick. It's actually thicker than Pulsatilla. It's so thick that the mucus is stringy. So whether it's in the eyes, have you ever noticed sometimes you're trying to remove mucus from the eyes and it comes out like a string? Or blowing your nose, it just doesn't quite end? Or or you have these big clinkers in your nose that has, once you dislodge it, there's a little blood on it, and then it reforms. That's Calibi. One of the other distinguishing features is not only the texture of the mucus, but Calibi is better with warmth, whereas Pulsatilla is worse with warmth. Calibi chromicum likes warm applications, they want warm drinks, they're better in the warm air, and
the description of what the discharge looks like is very important with this one.
Yeah, very, very important. Whether it's coming from the eyes or the nose. There's a peculiar symptom of Calibi that sometimes may occur, and it may be a tip-off that it's Calibi, and that's in the very, very early stages of a congestion. You may smell something like chlorine or bleach, and you're thinking it's environmental. It's that strong, but it's you. And it's soon to follow is a whole presentation of Calibi. It's not often that will happen, but it's a little tip-off that Calibi is starting to form. I remember getting on a plane to go back to New York, and I thought there was something wrong with the cabin air because I had this very strange odor. I thought, wow, that's weird. I felt okay. And by the time I got to New York, it was like, you know. So, Calibi.
So 2 more remedies. We're almost out of time here, so we'll get through them real fast. Chamomile. This is German chamomile. You guys have all probably had chamomile tea before. And What is it used for? It's used as a relaxing, soothing tea, a calming tea. So if we were to think of that in relation to how to think of that homeopathically, we're looking at what is the opposite of calming. It's incredibly irritated, incredibly agitated, inconsolable is a good word for chamomilla homeopathically in a chamomilla patient. So there's a few conditions that we see are really common in. Earaches are a big one. Teething, colic in young children, really, really common children's remedy. You'll see it a lot in children. It's kind of has an affinity with children. And the big striking thing about these patients, no matter what the complaint is, they're just going to be inconsolable when you're trying to help them. They're going to be screaming at the top of their lungs. They're not going to want you to get your hand anywhere near what is painful, what is hurting. They're not going to let you touch their ear if they have an earache. They're just going to be very restless, and any touch to any sort of tissue there's so much sensitivity. They're just going to cry out and shriek. So there's a couple of other big concomitants or remedy pictures here. There's this idea of capriciousness, or they'll be wanting to grab at things but then throwing them away. They really don't want to be touched when they're sick. They typically tend to be very thirsty, and they're very hot, warm-blooded people usually. They're children typically is where we see it. So the big modalities is going to be they get very upset and very angry. They're worse with anger. Even though they're pretty warm-blooded, they do worse in cold air. And they're typically much better, like Pulsatilla, from being carried. But a chamomile is going to be wanting to be carried very quickly. They're going to be have the mom walk fastly around the house versus just slowly, gently rocking them. And in terms of the description of what a classical chamomilla earache will look like, which is the main place we're going to see this remedy in this class, is that the ear is going to be red and it's going to be very, very painful. So the child is going to be screaming and just not wanting you to touch it, really, really demanding. That's where you think about chamomile.
Here's sort of the typical scenario for chamomile. It can also be great for teething. The young infant who's not able to tell you what's going on, they start crying. It's fairly intense. You try to console them, they're inconsolable. You try everything. Pretty soon, it's the opposite of Pulsatilla, where you become frustrated. You become unsympathetic. There was a time when mothers would kill their child because the child was so unavailable to consolation that it drove the mother crazy, and it made the mom want to kill the child. Throw the child against the wall or something terrible. And it used to not be a crime. So that was a chamomile child. And you will experience that in some children where it's just like, I'm so frustrated, I don't know how to help you. And there's this helpless feeling, and there's an angry feeling against the child, where you run out of options about how to help. And so it's the opposite of Pulsatilla, where you don't feel sympathetic. And it can apply to behavioral issues, not just an earache or teething. Very, very powerful remedy.
But it's important to see that picture that Dr. Todd is describing, not just, most children are going to be upset when they're acutely ill, especially if they're infants. So you shouldn't knee-jerk reach for chamomilla just because the child is crying. It's when there's that deep pathology of incredible irritability and just inconsolability that you want to think about chamomilla when.
Yeah, you've all seen a kid where you bring them the toy that they're asking for, and as soon as you give it to them, they throw it away. Or you rock them eventually to sleep in your arms, and you lay them down, they wake up. It's like, what can I do to help you? Yeah. So before you become violent, give chamomile. Silica, last remedy. Silica is a remedy like Pulsatilla, usually Calivi or Hepar Sulf, where it's later in trying to help resolve the congestion. Silica is a shy person, quiet, a little timid. Their congestion has become sort of lingering, and what we're trying to do is clean it up. Silica is basically glass. It's this hard mineral substance. It's stuff out of which glass is made. Consequently, one of the most interesting things about silica is that it helps expel something that has become infused into the person, whether it's a splinter or whether it's congestion. So it will literally expel a splinter if it's embedded too far to reach by a needle. It'll push it out. In congestion, what we're trying to do is finish up the congestion that has become chronic. It's a great finishing remedy. In silica, you'll also get, because of the chronicity of it, you'll get swollen glands that have become prolonged, swollen. You'll get a lot of crackling and popping in the ear because of the residual congestion that's still there. Again, kind of like Natrum Muriaticum, they're very sensitive and delicate and refined, but they're much more timid. They're chilly. They're kind of, you kind of have to spend more time figuring out this person because they're very shy and timid. They're not as forward as Pulsatilla may be. Worse in the cold, you can think of these things as pretty logical. They are better with warmth and wrapping themselves up.
A couple of other keynotes. The foul-smelling foot perspiration can really be a big one to tip you off to silica. So a kid with really stinky feet.
Or clammy,
yeah, with lots of sweat coming off, think about silica. Like Dr. Todd said, this is a very slow remedy, both in coming on and then in acting. So typically we're going to be using silica more in a chronic picture, like a chronic otitis media, not usually the right sudden acute one. And so it's going to be a slow onset of progression, but also of resolution. So when you give the remedy, don't expect an immediate response when using silica necessarily.
So for example, you may remedy the earache, the pain associated with it, the profuse, perhaps, congestion associated with it, but you'll notice perhaps that you have this lingering discharge. It hasn't quite completed itself, it hasn't quite gone away, whether it's sinusitis or whether it's an ear or a sore throat, swollen gland, you might be looking at silica. It's a great finishing remedy.
And there's this phrase, great need of energy, that really embodies silica very well. It's like they're frail, they're weak, and that goes right ahead with has convictions which they do not argue. So the silica person is going to be, have a strong opinion about something, but they're not going to come out and tell you, but they're going to be fixed in their ways. So it's kind of like, yeah, do this for me, do that for me, but I'm not going to really tell you what's going on because I have this lack of energy.
And at the same time, they're timid and shy and seemingly slow. If they're challenged, for example, they're asked to give a book report in front of class, and before they get there, they're like feeling very incapable, a lot of self-doubt, but as soon as they stand up and start to present, it's like brilliant. Their confidence is all there, their talent is all there. It's very interesting that way. And I want to just clarify one thing.
what we're talking about in these acutes, we keep saying constitutional. It's kind of like this. What we're talking about, this could be constitutional. This could be what's called miasmatic. We'll talk about this maybe at the end of class. This could be fundamental, and this is acute. It's the leading sort of spear of what it is that's causing the most suffering right now. So when we're talking about constitutional, we're talking about deeper issues, longer lasting, what's fundamentally characteristic about you as a person. Fundamental is acquired life experience, what has happened in your life that has created suffering. Miasmatic is what you brought in at birth that is characteristic of your genetics. So this is our focus in this class, is what is the leading sort of point of the arrow that is causing the most distress right now.
And this is a very huge, big concept to cover. So we're doing a lot of remedies. We're front loading them in the classes here, and there's going to be less and less as we go. So it'd be really nice in the next couple of weeks to have a more full discussion about this concept, because Dr. Todd and I want to help you distinguish between constitutional versus acute, and how we use all this information, because it's such a complex science.
Yeah.
So we'll get more into it. And we might even give you this diagram.
Yeah. And you know, this remedy that you select here works all the better if it's actually something that encompasses all these different aspects, right? We don't expect you to understand how to determine a miasmatic remedy or a constitutional remedy and all that. That's why we're giving you a lot of details in each of those modalities and keynotes to each remedy. Is the more you can kind of understand what makes that remedy unique from another remedy, the closer you're going to be to actually getting the right remedy.
So people who have a constitutional remedy, do they tend to have acute problems that fall into their constitutional?
Yes.
So like those people that you were just talking about?
Yeah, for example, there may be here constitutionally and miasmatically a bloodline that's predisposed to allergies or predisposed to heart disease or skin diseases. So there may be an acute presentation of that much more readily. It's a good question. Mm-hmm.
Yeah.
We're talking about allergies. What about asthma or like that kind of cough that could come on when you cough out an allergen that is like chronic or repeated and like really deep in the belly? What would be a good
Part of the reason that we're not covering that is because asthma is a pretty significant pathology. It can cause a lot of harm, and it's something that you wouldn't want to just kind of treat asthma homeopathically on your own, typically. And it's very often tied into this constitutional picture.
Yeah.
To be successful with treating asthma, it's very rare to just look at the acute symptoms and be able to find the right remedy. You need to understand the entire constitution and case of the person. So part of the reason we're not covering asthma is because there's literally hundreds of remedies that can be used for asthma. And the most important thing in finding that remedy is going to be in understanding the whole picture, which is kind of beyond the scope of this class.
Having said that though, if you're in an acute stage of the asthma and you need to ameliorate something that could become worse, it may be in your kit. For example, aconite, we talked about last week. Apis, which is a remedy. Did we cover that yet?
No,
we haven't.
It's under
We will cover that. Those two remedies are going to be in the kit, and those could be very good choices for a distressing flare of asthma. But it's not necessarily treating the chronic asthma. It's treating the acute asthma. Okay.